My name is Stephanie Rodriguez, and I am a family nurse practitioner with CHRISTUS Trinity Clinic. Originally, I was raised as a Navy brat. I spent most of my time growing up in Camp Lejeune, which was in North Carolina, before my family and I came back to Corpus when I was in high school. The biggest influence in my life would definitely have to be my mom and my grandmother. They both were homemakers, they raised families, and they were both very nurturing, and they are really what pushed me to further my education and be sure that I could be nurturing just the way they were, but in my professional capacity. I became a family nurse practitioner because I was a registered nurse for a very long time in the emergency room, and the longer that I took care of patients, I realized that I wanted to be able to help manage them in a greater capacity. I wanted to be able to help them with their chronic conditions and be able to provide care across the lifespan that really made a difference for them, not just at that moment in the emergency room when I had a couple of hours with them. What I love most about my specialty in endocrinology is that endocrinology is very near and dear to my heart. My husband has a very rare genetic endocrine disorder, and he was diagnosed over 10 years ago. So that really pushed me to learn everything that I could about endocrine before I decided to enter this specialty. So it's extremely important to me to give patients what my husband and I received when he was first diagnosed. And so I love being able to offer them the empathy and understanding that I know what they're going through as not just a caregiver, but as a family member. My philosophy and commitment to patient care is that I like to have a patient-centered approach with my patients. I like to help them understand what our plan of care is, why that's our plan of care, why it's important that we've made these decisions for them, and I like for them to feel like they have been a part of that plan. Because if they understand why we've made a decision to do what we're doing, they're much more likely to be successful and for us to have good outcomes with whatever plan we've come up with for them.